Again, we're very excited to have you join us today for this important health insurance forum to learn about a new member benefit through Anthem Blue Cross Blue Shield. My name's Dan Sale, and I'm your St. Louis Realtor CEO.
Yeah. Okay.
Being your own boss is exciting. We know that. You're in control and doing something you're really passionate about. However, I'm sure you'll agree that one of the downsides of being a 1099 independent contractor is the lack of group health insurance, a benefit commonly enjoyed by W-2 employees. And here with us today to talk to you about this program and to introduce our presenter today is our president, Matt Murin. And Matt, if you would take it away, that would be great.
Thank you, Dan. Hello, everyone. My name is Matt Murin, and I am your 2021 St. Louis Realtors president. At the association, we have a constant focus amongst the leadership and staff on the creation and offering of items of value. Today's forum represents the culmination of numerous hours of efforts and work over the past several years on a truly significant item of value now being provided by our association. I am honored and thrilled to have the opportunity to share this forum with you, my fellow St. Louis Realtors members. At an earlier board of directors meeting, the officers and leadership approved this partnership with Anthem Blue Cross Blue Shield to begin offering health insurance opportunities to our members. The members of St. Louis Realtors now have access to major medical, prescription, vision, and dental coverage from a quality major health insurance provider. This health insurance option is a member benefit for St. Louis Realtors and is extended to both Realtor members and affiliate members, as well as their immediate family unit. While we recognize this option isn't for everyone, we think this program has merit and could be a benefit to many of our members. Now, our industry works long hours, and we often put the needs of our clients above our own. Our members sacrifice our work-life balance and health in our efforts. No one working as hard as we do with the passion to help others that we do should have to be underinsured or, heaven forbid, uninsured. A NAR 2019 survey found that 33% of realtors are uninsured in any given year. That is 1 in 3 of us. My fellow realtors, that is truly wrong. That is why today's forum is so important to our members. Before the other individuals speak with you today, I want to share a message of thanks. Thank you to all the leadership, officers, and members and staff who have worked so hard to make today possible. Now at this time, I would like to introduce Brock Boyer. Mr. Boyer will share a brief overview of the program, as well as walk us through a demonstration of the online platform and how to quote, and then we will open it up for questions. Brock?
Thanks, Matt. Can you guys all hear me okay? Perfect.
Yes.
All right, great. Well, first off, I want to thank everyone for your time today joining, and I'll introduce myself. My name is Brock Boyer. I'm a rep here at Anthem Blue Cross Blue Shield, and I manage the state of Missouri, with which is where you guys are at, obviously. And I'm really excited to be offering these plans to you guys. The Realtor Association put a lot of time and effort into piecing this together for you guys. It's a great opportunity for you guys to have affordable coverage, because we all know that right now, health insurance can be very expensive. And some of the options that we're going to be going over today are very affordable, great plan designs, very robust, good co-pays, good prescription drug coverage, stuff like that, dental, vision. We're going to be covering all of that. So with that being said, I'm going to share my screen, and I was afraid that was going to happen. It says that the host has disabled screen sharing abilities for me. So until that gets figured out, I'll just kind of talk about the plan that we're going to be, focusing on right now. It's our Anthem Enhanced Choice plan.
Brock, go ahead.
Yeah.
You're just now made co-host, so go ahead.
Okay, perfect. 1 second. 1 second here, folks. All right. All right, I think we're good. Okay, as I was getting into, today we're going to be talking about our Anthem Enhanced Choice Plan. It's a new plan that just hit the market last year, and it really is a new kind of individual health coverage for the working uninsured, and it does really focus on meeting your needs and providing affordable healthcare coverage. So this plan, it provides coverage for nearly 36 months, and it really is a great opportunity for the members of the Realtors Association who do not qualify for financial assistance that's created by the Affordable Care Act or the ACA subsidies. So basically the way that works is if your income is within a certain range, you would either qualify for an ACA subsidy or not qualify. And when you don't qualify for an ACA subsidy, insurance can be extremely expensive. And a lot of times we spend a lot of time shopping the market and, trying to find an affordable option. And that's exactly what this plan is. This plan provides coverage for nearly 36 months over 3 12-month terms, and members only need to apply once. And you can apply year-round, not just during a special enrollment period, which is something that we just had, which ended in September, or which ended in, I think, on the 15th, actually, of August, which, just happened. So you can apply anytime you want. There's no restrictions on that. And one cool thing about this plan is pre-existing conditions are covered from the start once you're approved. So you will need to go through underwriting with this product, but once you do that, any pre-existing conditions that you have are covered. And what we see from this plan, going through underwriting, is that the plans are generally, if you're within, a certain age range and you don't have a lot of health risks, this plan really does provide sometimes 30 to 40% savings compared to, what's offered in the marketplace. And some of the benefits that are included with this plan, I'll just kind of touch on some of them. We got preventive care visits that are covered at 100%, prescription drug coverage with really affordable copays and out-of-pocket copays, and no referrals are needed for specialist visits, which is great. And then we are also offering a choice of 6 plans with a range of deductible options, with the lowest deductible option, obviously being the more expensive, and then you have higher deductible options. And I'll kind of get into that here in the next slide. So here you'll see a layout of the 6 plan options with deductibles ranging from $1,500 all the way up to $7,500, while maintaining the convenience of copays for select services, including primary care physician visits, specialists, urgent care, telehealth. And one thing to note, while primary care physician visits and specialist visits do have a copay, additional office services may be subject to the deductible and coinsurance here. So what you can see here is that these plans do have a 20% coinsurance amount. So once you've reached your deductible here, insurance will kick in and will cover 80% of the cost of that service until you reach your out-of-pocket max. And down here, you will see your tiered pharmacy copays. So we have level 1 and level 2 pharmacies that are available. Basically, if you go to a level 1, you're going to see a $10 copay for a tier 1 drug, which is, your basic drugs, not a specialty drug or anything like that. And then if you go to a tier 2 pharmacy, you'll pay a $20 copay. The main difference between these two are, a good example is CVS is a tier 1 and Walgreens is a tier 2. There are also a lot of other pharmacies that are included in this, all the major pharmacies. So, the coverage is great there. And then this plan does have a $1 million per member benefit maximum per benefit period. So that's also one thing to note. So let's talk about the medical underwriting here. So the process is extremely easy from start to finish, from the application all the way to the final underwritten rates and you actually, paying your first premium. It takes about 5 minutes to apply and get to that final stage. So what we're going to do now is we're actually going to post a link in the chat box for you guys to actually access the quoting site, and you guys can get in there, run quotes for yourself. You'll see how easy it is. And it's basically just entering in some basic information. You'll select your plan, and then it'll take you through the underwriting process. It'll take you through the application, all that stuff. So basically, once you submit the application, it will go to underwriting, and underwriting will place you in a risk level, or I guess I can't think of the word right now, but you're either going to be preferred, standard, modified 1, or modified 2. Preferred is going to be the lowest risk and the lowest cost that you're going to see, all the way up to modified 2, which is going to be your higher risk, and you're probably going to see a little bit higher costs, just because underwriting saw some health conditions that could potentially, cost more money, which would actually raise the cost of your premium. So in a case like that, that may be a good option for you to, shop one of our ACA plans, go on the market, do something like that. So during the underwriting process or during the application process or anything like that, we do have a new member advisor number, which is listed here. We can also post that in the chat box as well. If you guys have any questions during the process, or want to follow up on an application to see where things are at, you can call this number. We have a dedicated support line for you guys to reach out to. So the help is there, and if you need anything at all, they're definitely there to help. So we also offer Anthem Dental and Vision for under 65 aged individuals and seniors, which I'll get into now. So Anthem is a leader in the industry for dental and vision. We've been delivering, solid, special or great products for over 45 years. We have one of the largest dental networks in the country. There's over 38,000 eye doctors, over 27,000 locations online and in store. And we offer the deepest network discounts, in the market. So these plans that we are offering, they're backed by the Anthem name, and they really are great products. So here's here's 3 packages, just kind of show an example of what we, offer for the dental and vision. So you can do like a standard package, which would package the dental and vision together with a few extras. I'll kind of get into these: the silver sneakers, travel assistance, member assistance. But this kind of goes over the copays here, and you see as you go up in the package level, you'll see a more robust plan design, higher allowances, but you'll still see these same extras that are available for each plan. And all of this can be quoted on the Anthem Realtor portal. So with all of these plans, all members do have access to all of our online digital apps and networks and stuff like that. So first one I want to talk about is our Sydney app. It's an all-inclusive app. It lets you download your ID card, keep track of your claims. You can basically keep everything on your phone. It's really handy. I actually use it myself. You can go to the eye doctor. You don't have to keep your physical ID on you. You just show them your phone with your ID card. You can pull up your summary of benefits. You can look at, what your copays are. All of that is available on the Sydney app, which you can download on the Google Play Store or the Apple App Store. One other cool thing is you can find doctors that are in network. So that's one thing I do want to talk about is the network here. These plans are going to be on the Pathway Network, and they are EPOs. So there's going to be in-network benefits only. So you would want to make sure that wherever you're going to the doctor, that it's going to be in network. So you can find these doctors here on the Sydney app. And then another thing to note is that if you do have, for some reason, an emergency situation or something like that outside of the state, or you're not near an in-network doctor or hospital or anything like that, you can see emergency service, or you can have emergency services that are covered at the network level. So you wouldn't be, charged $10,000 to, go to an emergency room if it is an emergency. So that coverage is there. And, that's something really important to note. A lot of plans on the market right now do not offer that. And that's about all we got for this presentation right now. So one thing I do want to talk about are a few underwriting guidelines. So as far as member eligibility goes, exit out of these. Sorry, my dog is shaking and scratching and getting antsy over there right now. I'm sure you guys can all hear that. But as far as the member eligibility goes, this is for member or applicants 0 to 64 and 3/4 years. And those are the only ages that may apply for coverage here. We do offer senior benefits, and we can talk about that if you have any questions. And we can send out all of this stuff. This basically covers all of the underwriting guidelines and some of the conditions that aren't covered and stuff like that. So with that being said, that's basically all I had to share. This is a great opportunity for you guys. Make sure you enroll through the link that we provided in the chat box. That way, the Realtors Association can have, keep track of the member benefits and all that stuff. And that's all we have. I'll open it up for questions. If anybody has anything, I'll stop sharing my screen. I don't think I turned my video on. This is what I look like, so you can put a face to a name. So,
Brock, a question we have is someone asking what the underwriting support number is.
yeah. Let's see here. We can post that. Brad, do you have that number on hand? Right.
While Brad is maybe looking for that, Brock, another question came in asking if there's a minimum time commitment. In other words, can you cancel at any time?
That's a great question. Here, all right, I just posted the number in the chat box. So with these plans, there is no minimum time frame that you can have these plans. You could have it for 2 weeks if you wanted to. So it's a great gap filler. Like if you're coming off a COBRA for a plan or something like that, or if your spouse loses coverage. I assume a lot of people are covered by their spouses. So if something does happen, this is a great option. Quick, easy quoting. So there is no time limit. Any other questions?
I am not seeing any. We'll give individuals a couple more minutes, and while we're waiting here, I just want to mention that we have a wealth of information on our association website regarding this plan. And you simply go to stlrealtors.com. And from there, click on Member Center, where you'll want to select the tab that says Member Benefits. And then you'll want to click on the box with the Anthem logo. And
correct.
Again, you'll find a variety of resources. We've got a recorded program from earlier in the summer, and contact information and phone numbers as well.
So Dan, there is one thing I do want to note about this plan is people, are kind of looking for answers and, kind of doing some research on it. So the effective date of coverage on these plans is the 2nd of the month. So any application submitted between the 1st and the 25th of the month, the effective date will be on the 2nd day of the following month. And then any application submitted between the 26th and the last day of the month, the effective date will be the 2nd day of the 2nd following month. So that's one thing to notice. So make sure you get your application submitted before the 25th. So today would be the last day to apply for coverage for 9/2. Does that make any sense to everybody? Hopefully it does. And the reason for the 2nd of the month effective date, there's a rule behind that's created by ACA that only allows plans to have coverage for 364 days. So this plan works around ACA and provides full major medical benefits, and having that 2nd of the month effective date allows it to stay within those regulations. So it really is a great plan, and kind of fits right around that ACA, and provides a really good affordable option for you guys.
Brock, a question that's come in asks, can you call or meet with us one-on-one?
Me personally, I'd be happy to have a phone conversation with anybody, and we can work stuff out like that. But we do have an agent that is working with the realtors right now that is with USI. His name is Michael Kilker. We did post his name and number on the quoting site. So if you do follow the site here, and I'm going to post this in the chat box right now. And if you scroll down and hit shop now, show now, you'll actually be able to see, it'll pull up the agent information, and he's very knowledgeable in the product and extremely helpful, and is dedicated to working with you guys. And if you have any questions at all, feel free to reach out to him. So his number is listed on the page there, and you can shop the individual plans there. And Dan, I believe you did send out the PDF to everybody with instructions on how to quote. Is that correct?
Correct.
Okay.
Another question has come in asking if children can be on the policy, Brock.
Yes. So children can be on the policy. There's no limit to how many dependents you can have on the policy, but all children applying without a parent or guardian must apply separately.
Another question. These are good questions, by the way. What sort of conditions would bump you into the modified 1 or modified 2 tier?
It's a great question. So that would be based off of, I don't know if we have an underwriter on the line right now. If we do, I'll let them answer that question. I'll give it a couple seconds. If they don't, I can kind of give my little answer.
Hi, yes, my name is Daphne, and I am a senior underwriter with the AEC product. Yes, there are different conditions. It depends. Some conditions have different risk levels. So it would really just depend on the condition as to what condition would put you into a modified 1 or a modified 2 rate.
Great. Thank you so much. So
there are some conditions
couple...
that can be combined as different levels that would put you in there. Just to say, if you had multiple conditions, the different points will get you different to get you to that level, or it could be a single condition. It would just really depend on that particular condition and the treatment for it.
Okay. Thank you so much for that.
Another question asks, should we apply now, even if we don't want to begin until January 1st?
You can apply if you want. right now, I mean, you can see where the rates would be at. You know, you can reapply again when January comes around, but typically when you want to apply for coverage, you would apply around that time. You can apply for a different effective date. So if there is a January effective date that you're wanting to look at, I'm not 100% sure if you can quote January 1st yet. I can check really quick, but let's see. I'll check right now, actually. So the furthest you can quote till is November. So you would have to wait about 2 months, probably till 10/1 until you could quote January 1st.
A related question is, can we begin a dental or vision plan prior to beginning a general health plan, or are they tied as one?
They're actually not tied together. So the AEC plan and the dental and vision are two separate policies. So you would be able to apply for dental and vision, and then, you know, later on down the road, apply for medical. So if you click the link below or in the chat box, you can actually, and hit show now, you can see the different options. You'll see individual plans and Medicare plans. And then in order to get to the dental and vision products, you would just click Affordable Care Act. So those dental and vision plans are offered through ACA. And then Anthem Enhanced Choice is the product we talked about today, and that's going to be a completely separate product.
Thank you, Brock. Another question asks, relating to the coverage start dates, if we use this plan for 36 months and need to cancel, when do we need to notify you in order for coverage to stop? In other words, how quickly does canceling take effect?
So that's a great question. Would the underwriting team be able to answer that?
I'm sorry, could you repeat the question? I didn't hear it thoroughly.
Yeah.
It's
So-
related to
Go
coverage
ahead, Dan.
start dates. If someone is intending to, you know, begin a plan for the 36-month period, but for whatever reason they need to cancel, how quickly after they notify you does the coverage stop?
That I don't know the answer to, but we can get the answer to it, because at that point it goes into membership, and that's not a particular area that we handle, but I can get that information and see if we can get it to you.
We will write that down.
Yeah, I don't
Yeah.
think it would be a long process. I would think it would just be the process of contacting our member services and letting them know that you what date you request to cancel.
There is a question, Brock, asking for your email address. I assume that's direct.
Yeah. I can post. So. And.
Another question asks if
yeah.
spouses can also be on the policy.
Yes, spouses can be on the policy.
I think this one was already answered, but it asks, is there any commitment to the program if we apply and get a quote?
No commitment. So you can go on here and just do a quick quote. The commitment is made when you pay that initial premium. By paying the premium, you're accepting the terms and conditions of the policy and you're officially enrolled. So until that time, you're not, there's no commitment made.
This question asks, if the effective date is the 2nd of the month, will I not be covered from one day when switching from one plan to this?
That is a great question, and that is the case. So once that's just for the initial enrollment though. So for that one day, you would have to, I mean, play it safe. For we do have short-term options that are available through the exchange, but that's something that you may need to, work around, but that would be the case since the effective date would be the 2nd of the month.
Another question asks, if you are covered under the ACA plan, do you have to wait until January to apply for this policy?
Can you repeat that one more time? I was typing something in the chat box.
Sure. If you're covered under the ACA plan, do you have to wait until January 1 to apply for this?
No, you would not have to. So you could, switch your coverage and cancel your ACA plan and move over to the AEC plan.
This question asks, do you offer Medicare PPO plans for those over 65 in the Realtor program?
Yes, we do. So I can show right now on the screen. So this is the screen that you guys are going to see with the quoting site. So you will be able to quote either Medicare plans. So when you go to that link that was sent in the chat box, you'll see this come up here. Here's the agent contact information for Michael Kilker. And then you'll see the individual Affordable Care Act plans, and then your Anthem Enhanced Choice plans. You'll be able to get a quote there, or you can select Medicare plans, which you can also get a quote for. And you would just click on that, and it would take you to the quoting site, which I think sometimes when I'm on these Zoom calls, my internet is really slow. So hopefully the quality of my voice sounds all right now. So anyways, that's how you would do that. We do have the options available.
I'm not seeing other questions. Well, there is one question, says the quality of the voice is not real good. Can we send an email with the plan detail information? Probably the best thing to do would be to go to the resource page that we have established on our website, where you'll find all of that information or links to that, all of that information.
Correct. So I can show that, Dan, actually right now, and just to show people how to navigate to that page. So basically what you're going to do is you're going to go to the St. Louis Realtors insurance, or St. Louis Realtors homepage. You're going to go to the Member Center, and then you're going to click on Member Benefits. And then you'll select Anthem here. And then once you select Anthem, right here on the side, you'll see a bunch of different informational materials, different recordings from past sessions that we've had. A lot of good questions have been asked. Some videos, some find a doctor flyers for the Sydney app. And then we also have a medical quote tutorial that basically takes you through how to quote, which is a tutorial that I created, and it should work out pretty well. So that's where you would find everything. Hopefully that helps. Sometimes it helps to kind of see somebody else do it to help navigate there.
A question asks, if I already have Anthem insurance currently, do I need to re-enroll, or am I already a member? And does this just transfer to this particular program?
So it wouldn't necessarily just transfer over. It would depend on what type of insurance you have. So if you have Anthem insurance through your spouse, this wouldn't be that type of plan. This would be for members that, do not currently have coverage or have coverage elsewhere and are looking to save, money on their, premiums. So you could, run a quote still, even though you have insurance, and, potentially change your coverage and cancel your old policy. You would need to cancel your old policy first, so you would be able to have two at the same time.
Any final questions? Looks like the well is maybe run dry on questions, but we had a lot of really good questions. With that, I'd like to thank, well, there's one that just came in real quick. Can you get a quote without applying? I think that's been answered. I mean, you basically apply, you walk through the steps to obtain the quote, but it doesn't commit you until you make that first premium payment, correct?
That is correct.
Okay. And again, Brock has posted a link in the chat for additional information. And I think that that wraps it up. Brock, thank you for your time today, and thank you to your associates for joining us as well. And thank you to our members for your interest and participation in today's webinar.
Thank you, Dan.